BSI, scene is safe. This is my only patient. Hi, my name is Carly. I'm with the Corvallis Fire Department. What's your name?
My name is James.
Hi, James. What's going on today?
I'm really having some trouble breathing.
Having trouble breathing.
Yeah.
Okay. All right. I don't see any major bleeding. Did you fall or have any other injuries? So I don't need to consider spinal precautions. So what I'm gonna have you do. What I'm gonna do is put some oxygen on you. It's gonna be 15 liters per minute and an on breather. So I'm gonna apply that. All right. So I just want you to take some deep breaths through. Just keep breathing evenly. Okay, I'm going to keep asking you some questions. Okay, just regular, normal breaths. Good. Okay, I'm going to be taking your blood pressure and pulse. Okay, even breaths. Is that making you feel any better? A little. Okay. So I want you to just take normal breaths. Okay, normal breaths. All right. Okay, so can you? Aside from trouble breathing, are you having pain anywhere? No? Are you feeling any better with this oxygen? Okay. All right. Do you have any allergies to medications?
Just amoxicillin.
Amoxicillin. Okay. Are you on any medications? Yeah, what medications are you on?
Paxil
Paxil. Okay.
and Prozac.
Okay.
I think that's it.
Okay. And do you have any medical conditions that I should know about?
Erectile dysfunction.
Okay. What else?
That's it.
Okay, so at this...
Asthma.
Okay.
I have asthma.
Okay. At this time, we've obtained a blood pressure that's 130 over 80. Respirations are at about 18 at this point, and pulse I've taken is 68 and normal. Okay, so you have asthma. So do you take anything for your asthma? What do you take?
No, inhaler.
An
Albuterol.
inhaler. Okay. Do you have that with you? No, you don't have it? Okay, so at this point, since he's not allergic to albuterol and he has an albuterol inhaler, I'm going to begin a nebulized treatment of albuterol. Have you ever done one of these? Okay, so I would set that up and have him, I could attach it to his non-rebreather or give it to him separately. At this point, I'm just going to have him hold it in front of his mouth. So I'm going to have you hold this. I'm going to ask you some yes or no questions. I want you to take some deep breaths in, hold it, and then you can breathe out. Good. Good. And you can actually just breathe through the nebulizer. Okay. All right. What was the last thing you ate?
Pickled eggs.
Pickled eggs. Okay. How long ago was that?
3 hours ago.
3 hours. Okay. And have you been having normal bowel movements?
Kind of more diarrhea lately.
Okay. All right. How's that inhaler going?
Good.
Okay. So how long ago did this start?
The diarrhea?
No. The trouble breathing.
Couple hours.
Okay. A couple hours. All right.
So.
And on a scale of 1 to 10, 1 being no pain or trouble breathing at all, 10 being the worst possible pain you could imagine, what number would you give it?
9.
9? Okay. After the inhaler, is that helping at all?
It's about a 7.5.
Okay, so it's getting better. So we're going to continue treatment with the nebulizer. All right, and what does it feel like?
Just really tight, kind of constricted,
Okay.
kind of hard to take a full breath.
Okay. So does it feel like what a normal asthma attack feels like? Okay, do you have any pain radiating anywhere, or is it confined to your chest?
Mostly just here.
Okay. Is there anything that makes it better or worse?
Cold air usually seems to help a little bit.
Okay. All right. And so can you explain to me what you were doing when this happened?
I was mowing the lawn.
Okay, mowing the lawn. Did it come on pretty suddenly?
More or less.
Okay. So did you have a feeling that it was the asthma, or were you not sure what it was?
Wasn't sure if I'm just allergic to the pollen in the air or the grass, or if it's the asthma.
Okay. All right, so I'm going to have you continue with the nebulizer. What number are you at now?
A 5.
Okay, good, awesome. Okay, so this started a couple hours ago. And then how long ago did you decide to give us a call?
My neighbor called you about 10 minutes ago.
Okay, all right. So at this point, I'm going to reassess vitals, at which point I get the pulse is about the same, 68. Respirations have come down a little bit to about 15. And then our blood pressure has also come down a little bit, 120/80. At this point, I would like to possibly transport you. I believe that this is a pulmonary issue. He has asthma. This is a pretty standard asthma attack for this patient. I don't think that this is a cardiovascular problem. He has no pertinent cardio history. And I don't think it's GI, GU. I don't think it's musculoskeletal or an issue of his mental state. So I would like to take you to the hospital, have you get looked at, especially because you don't have an inhaler here at home. Is there anyone else that lives here?
Just my grandma.
Your grandma? Okay. So as my patient is a young male in his late 20s, and his grandma's the only one here, I'd like to have him looked at and transported. What I would do is reassess vitals every 5 to 10 minutes, and hopefully his symptoms continue to improve with the treatment. I would continue to give him an albuterol nebulized treatment as needed, and as I pass this along to higher care, I would say I have a 28-year-old male named James. He has asthma. He does not have his albuterol inhaler with him, but he has been prescribed an albuterol inhaler. He was mowing the lawn about 2 hours ago when his symptoms came on. His neighbor called us about 10 minutes before our arrival. He was at a 9 when we first arrived. After about 5 minutes of treatment, his discomfort came down to a 5, and he's allergic to amoxicillin. So that is all, and we hope that he gets better.